I'm Sarah.
I'm Natalia.
And I'm Karin.
I'm Caroline.
And we're occupational therapy assistant students at Austin Community College in Austin, Texas.
With the help of some friends today, we hope to expand your knowledge on occupational therapy and more specifically the role that we play in the lives of children and how we benefit kids and families.
It does therapy on your occupations?
Yes.
I think OT is where they help people and children who have certain disabilities, kind of and if they were in an accident or something and then they forgot how to do something, they help them do it.
According to the American Occupational Therapy Association, occupational therapists and occupational therapy assistants help people across the lifespan participate in things they want and need to do through the therapeutic use of everyday activities.
Occupational therapy sounds so cool. Who gets to go?
Well, Franklin, in pediatric occupational therapy, you find kids from birth to 21 with a variety of special needs. Some are born with conditions like Down syndrome or Williams syndrome. You'll find kids with neurodevelopmental disorders like intellectual disabilities, autism spectrum disorder, and attention deficit hyperactivity disorder. There are kids who have cerebral palsy or spina bifida or orthopedic conditions, and there's juvenile rheumatoid arthritis, which is a painful joint condition. Some kids could have been affected by trauma or seizures, and there are even kids who have vision and hearing problems who need occupational therapy.
Oh, that's a lot to remember.
I know. I've listed a lot of different disabilities and conditions kids may live with, but really, OT is for anyone who struggles with anything that interferes with the things they want and need to do every day, like communicating, motor skills, learning, self-help and independent living, and even appropriate behavior. Occupational therapists use what they know about the conditions I mentioned and many others in order to design interventions to help kids function in their everyday lives.
I got a cut the other day that got in the way of making a bug sandwich. Does that count?
Well, I think a Band-Aid is really all you need for that.
Oh, I was just kidding anyway.
OT is a holistic form of therapy that addresses the child on a physical, mental, and spiritual level. Our goal as OT practitioners is to engage the child in activities that they enjoy and that are meaningful to them and their family so that they can move forward in life, functioning independently and with confidence.
So, what exactly are everyday activities for children?
Well, Franklin, for children, everyday activities may include things like dressing, feeding, playing, social interaction, anything what is important to the child and the family.
Oh!
Interventions OT practitioners may use include things like playing goal-directed games with children utilizing special equipment in gyms to address sensory motor issues, fine and gross motor skills, balance, coordination. Children can work one-on-one with a therapist or work in groups with other children to enhance social interaction skills. These interventions are aimed at empowering children to function independently in self-care activities such as dressing, bathing, and feeding, skills required for school tasks such as handwriting and cutting, problem solving, and of course, play.
Depending on the needs of the child, the strategy of the therapist may look different. It may look like all fun and games on the surface, but behind every activity is research and scientific evidence to support each decision to ensure the child is challenged in ways that will support their ability to be independent.
In occupational therapy, a variety of frames of reference are used to direct intervention. For example, the developmental frames of reference is based on principles that development occurs over time and between skills, for example, gross and fine motor. Some children experience a gap in their development due to physical, emotional, and/or social trauma. The role of occupational therapy is to bridge this gap. Treatment modalities include identifying the current level of functioning and working on the next step to achieve the skill. Intervention includes practice, repetition, education, and modeling of skills. Children with sensory integration dysfunction have difficulty processing sensory information, such as vestibular, proprioceptive, and tactile. Improvements in sensory processing lead to improved engagement in occupations. Treatment modalities provide controlled sensory input to improve the child's ability to process sensory stimuli. The OT will use suspension equipment and the just right challenge and provide activities that are child-directed. Other approaches commonly used in pediatric occupational therapy include the biomechanical approach, neurodevelopmental, model of human occupation, and rehabilitative approaches. Each of these approaches is based on research and is chosen based on the child's therapeutic needs. Next, we're going to hear from a couple of moms whose children and families have benefited from occupational therapy services.
Well, he wasn't progressing like the other students in class, so we went to the doctor, and his pediatrician said, why don't we go ahead and send him to a neurologist? And so the neurologist did some testing and noticed that he had some developmental delays. So she had referred us to seek out some OT therapy. And so then she gave us some recommendations, and then we took it from there. Okay, he couldn't walk up and down the stairs at the house. He was having a difficult time having the coordination to do that. So they taught us some tricks and ways to help develop that. And then once they taught us, it was pretty quick after that. They worked on both gross and fine motor skills. They did a lot of working on his wrist strength. So, he wasn't doing very well with writing. He couldn't decide at 4 years old whether he wanted to write with left or right, so they were still trying to help him develop which side he was going to write with. And then for gross motors, they did a lot of upper body skills. They used a swing. They had him doing like a Superman plank. So just a lot of, back and forth. He would do an hour, so he'd do 30 minutes with fine motor and then 30 minutes with gross motor skills.
So we knew he needed therapy when he was born because he was born with Down syndrome, and he spent like 2 weeks in the NICU. By the time we left the NICU when he was 2 weeks old, the caseworker had set us up with occupational therapy. And so by the time he was 3 weeks old, we had the therapist come into our house to work with him. And it really made a difference. I really feel like OT helped him reach the milestones that he needed. It made a really big point of working with us and asking me what my goal is for him. And so I get choked up because my goal for him, was to walk into his preschool when he turned 18 months old. And so she works really hard with him and worked on his core strength and worked on like sensory issues with him. And he walked into his preschool. He was 18 months old. So OT has continued to be there for him. To help him with build that core strength and to be able to sit at a table for extended periods of time and to be able to do the fine motor skills that he needs to do. And also I think in some ways to help him with those sensory issues that when he gets overwhelmed or something like that, it gives him those skills to be able to, kind of face those challenges that he's had.
Between an occupational therapist and an occupational therapy assistant?
Well, Franklin, that's a really good question. The occupational therapist oversees the entire therapy process for each family, from initial evaluation to treatment and eventual discharge. They will have earned their master's or doctorate level degree. In some settings, they have occupational therapy assistants who collaborate with the OT during the evaluation and intervention. Their primary responsibility is to work with a patient or child and implement the treatment to meet the client's goals. To become an OTA, you'll need an associate's degree, but both OT and OTAs will need to have completed fieldwork hours and passed the national certification exam. Then the practitioner can even choose to specialize in a specific area like low vision, school systems, and feeding, eating, and swallowing.
Wow, occupational therapy sure sounds like a great profession. I want to tell all my friends. Where can they get more information?
A great place to start would be at aota.org, where they have tons of resources about our profession. And you know, you're always welcome to come ask me or any of your other OTA student friends.
We hope that you've learned something about occupational therapy in pediatric setting.
And we hope you tell your friends.
Happy OT Month!